532 new infections were recorded in Victoria yesterday, another grim new record for the embattled state. And there were 6 deaths, 5 of which came from aged care. Melbourne's halfway through a 6-week lockdown, but as you can see here, there's no sign of flattening the curve. Victoria's Chief Health Officer says modelling shows yesterday should have been the peak, but they can't be certain. The state's aged care system is at the centre of the battle against a seemingly worse second wave. Just 3 weeks ago, aged care residents in Victoria were not among the state's coronavirus cases. Now they account for close to 700. The hardest hit is St Basil's and Faulkner, with 84 cases and several deaths. There are also 82 cases at Estia Health in Ardea, 77 at Epping Gardens Heritage Care, and 62 cases at Menarok Aged Care in Essendon. In New South Wales, there's better news. It's been more than a fortnight now since the Sydney's Crossroads Hotel cluster emerged. At the time, Premier Berejiklian said its threat had brought her state's recovery to a crossroads. But rapid contact tracing and strict health measures has so far seen new numbers confined in the mid to high teens range daily. Of the 17 new cases in New South Wales yesterday, only 2 were under investigation. The rest were linked to hotel quarantine and known outbreaks like the Thai Rock restaurant in Sydney's southwest. There is increasingly cautious optimism that New South Wales' aggressive tracing will keep its current outbreaks under relative control. Looking at the situation nationally now, there are now more than 4,700 active coronavirus cases in Australia. Based on Victoria's current trajectory, the nation will today pass the 5,000 threshold. All states and territories, with the exception of New South Wales and Victoria, are currently not recording cases of community transmission, with their cases confined to quarantine.